Great. Good morning, everyone. Welcome to our April edition of the MARG, or the Multidisciplinary Advocates and Researchers Group. My name is Sharayla Haynes. I am the Community Partners Project Manager here at Frontiers CTSI, Clinical Translational Science Institute. Although our offices are located in the University of Kansas Medical Center, our partner institutions include St. Luke's, Children's Mercy, K-State, KCU, UMKC, and the University of Kansas Health System. I think I covered everyone.
You
I'm
forgot
so,
K-State.
okay, in K-State. I think I said K-State. Maybe I said it in my head. I'll watch the recording back and we'll see for sure. Okay, let's take a bet, Kelly, and we'll see. Thank you so much for joining us this morning. We have a really exciting presentation for you, and I'm looking forward to it. While I know I am ingrained in information about the Equity E2Plus project, I am very excited to learn more about how it's doing nationally, regionally, and all the things. So I'm excited for that. I am going to open up with some announcements, of which I don't really have that many. Here at Frontiers, we have completed our research symposium. It was a success, and we did have plenty of MARG members that attended that symposium. Can't wait to start thinking about next year. And we do have a date coming up for an in-person. Um, Alan, what would you call what we have planned for July?
I mean, I don't know what we haven't decided yet. We're having a big advocates celebration because we love our community partners, our patient advocate partners, and we just decided we should get everybody from every group, from every institution in our region and throw a big party. It's going to be a busy weekend. We're going to do it July 3rd, but you will be hearing more soon.
Yes.
I don't know. Somebody thinks of a better term to call to use for our big celebration of getting great guidance from great partners. We probably need a catchy name, but
Thank you, advocates.
That
Very to the point. Doesn't rhyme. You can keep thinking about it. We'll brainstorm.
The artist in me is not settled with thank you, advocates. I feel like it should have some more snazz into it. I don't know, some jazz hands.
I'll keep thinking. Okay.
Margaritas for the MARG.
That one beats mine by a mile. All right. Fair enough.
I'm going to put that one on the list.
So over 21 only. Sorry.
And that's why,
teens can't come. So we got to think about that one.
Yes, we do. And this is a family-friendly event. So maybe I might have to cross off margaritas with the MARG. I don't know, Dalton. We'll see. And if you're watching this recording back, we are looking at the comments in case you're like, where did that even come from? So it's like, what are you talking about? Dalton is a true creative, and he will probably come up with a name for this thing, to be honest. We'll see. So yes, that is coming up. There will be a flyer that will be coming out, but you can mark your calendar. As Alan mentioned, it is going to be a busy weekend, and I know it's a holiday weekend and people have a lot going on, but we want to get together and just show our appreciation for all of the way that you share your expertise, your time, your efforts, all of that with us, and just kind of kick back and relax, especially with everything that's going on in our country right now. It's a great opportunity to infuse joy into our what do you call it? Our auras, I'm trying to be in my spiritual bag right now. Oh, wait, there was another comment. Terry, what did you say? Oh, okay. I thought this was another title name. I was like, seeking practice sites to attain. No, that's not it. So, Terry, you are on the ball. So, as usual, if you have things you would like to share with our MARG community, please drop them in the chat or email me. I am putting together the MARG bulletin today to go out tomorrow or Saturday, and it includes not only our research-specific items, but community-specific items all across the region of Kansas and Kansas City, Missouri as well. So anything you would like to share, oh, Emily, I like that. Again, you can drop it in the chat or email me directly. I'm at chaynes@kumc.edu. You received an email from me to get to this invitation, so you probably have my email address already. I don't think there are any other announcements. Tamara, Alan?
Not that I can think of. We may have a little time at the end too, so if people think of things during the session, or of course, drop things in the chat too. But
yes, Emily, Advocacy Appreciation Celebration. Listen, I think we have a winner chicken dinner. And who doesn't like alliteration? Honestly, heart by that. Okay. I think we are moving into our presenters for today. Today we will typing back the words you said. We're talking about E2Plus testing engagement strategies to promote trustworthy academic institutions and greater diversity and capacity for patient and community leadership and research. Alan, I don't want to take the wind out of your sails. Do you mind if I read bios to introduce?
Do it.
Okay. So we have Virginia Chitwood-Sedore, MPH. She is a current doctoral student in health equity sciences at the University of New Mexico College of Population Health, with a concentration on community-based participatory research. Her previous work has centered around direct service provision of services to communities across New Mexico, with a focus on operating community health worker programs and training at UNM's community health worker initiatives. She has also worked on a nationwide opioid use harm reduction training for CHWs and the Good Health and Wellness in Indian Country, or the GHWIC, Diabetes Prevention and Management Program for Native American Communities with Project ECHO. Ms. Chitwood-Sedore is currently a graduate research assistant with UNM's Engage for Equity Plus project on advancing the science of engagement. And now, Dr. Prajakta Adsul, Assistant Professor of Internal Medicine and member of the University of New Mexico Comprehensive Cancer Center, leads as the inaugural director of UNM's Center for Advancing Dissemination and Implementation Science. A primary care physician by training and former NCI Cancer Prevention Fellow, her research uses community-based, participatory methods to design and implement pragmatic interventions that address cancer prevention and control challenges in medically disadvantaged populations, both locally and globally. In collaboration with Dr. Wallerstein and Sanchez-Youngman, Dr. Adsul is working with UNM's Engage for Equity Plus team to address the institutional context for supporting and advancing the science of engagement through funding from the Patient-Centered Outcomes Research Institute, or PCORI, as we call it here in Kansas. Please turn your attention to them. You're welcome to share your screen at this time. I will be monitoring the chat if you have questions, or if you comments, anything, we'll be monitoring that as well. And I turn it over to you. Thank you so much for joining us in University of New Mexico time. I know you're earlier than us, so I appreciate you joining the call today.
I have my coffee. Thank you so much for this invitation. We are super excited to be here. I'm Prajakta. Virginia is around on the next of my screens, I think. And we are so grateful to talk to you from Albuquerque, New Mexico, which is the land of the Pueblos, the Sandias, and the Apache, and 19 wonderful tribes that live in harmony with us. And I'm so grateful to be able to work in collaboration with them for the empowerment of our communities in New Mexico. And now I have to add the phrase "and beyond" because I have this wonderful collaboration with Kansas. And when I immigrated to this country 15 years ago, my first city was St. Louis, Missouri. So I have connections, and I married somebody from the Ozarks. So I have deeper connections. So I feel like I'm just talking to my family back home. So thank you for allowing us to present a little bit about this very exciting project that we've started somewhere in September, October. And so we are very much in the middle of actions in this space. And so let me share my screen and get started. Good. Sharala gives me a thumbs up. Thank you. The title that Sharila read off is a little bit different than my title, but that is what titles do. They change and they evolve as we think about what we are talking about. But really, this is a PCORI-funded project and it's a very unique award for science of engagement. So we're very grateful that Picori has recognized that it's not just about outreach and engagement. It's not just about like connecting with people. It's about actually studying how do we do better engagement? How do we do better connections with community leaders? How do we build that capacity on the community assets and actually start creating some leadership opportunities for the community? So actually they can help researchers like us tell us what is most important in the community and what is most to be focused on. And if we start that early enough, if we start that from a very institutional perspective, from a all of us perspective, and you guys are leaders with even just this MARG group, it's so exciting to hear the dynamic back and forth between all of you. How could we then promote an institutional support for engaged research? And that's where we were a year ago when we got funded for this work. And really, the leads in this space are Nina Wallerstein and Shannon Sanchez Youngman, who have been our fearless leaders in this space. And then within this project, we have divided ourselves as liaisons with specific universities. And I am one of those liaisons for Kansas University, and Virginia is helping support this engagement. We also want to acknowledge Michael Mohammed and Paige Castro Reyes from the Campus Community Partnerships. Michael Mohammed is at the Center for Participatory Research at UNM. But these are two folks that bring a very deep community perspective that align with our academic perspectives. And we as a 4-person team are helping create this project and some of these activities, which I'm excited to tell you about. So, oops, didn't test the next button. We wouldn't do this work just by coming in from New Mexico. What we have been very blessed with is working with a champion team within the University of Kansas system. And this champion team is comprised of academics and community partners. So you see Alan Erin over here and Reverend Eric Williams, who are leading this champion team within the university context. And I couldn't quite quickly find photos for all of the other members, but I'm hoping that by the end of this project, we will have those photos with Reverend Tony Carter, Charla Smith, Ida, Jody, Mariana. I saw Mariana a little bit ago, and Elaine Johannes. So this group has been our primary. Oh, hi, Mariana. This group has been our primary group that we've been meeting monthly and really being interacting and engaging with them through the work, through the project activities. So what is this project? This project was developed to strengthen institutional support towards patient and community leadership in engaged research. We had 3 aims. As I said, to work with champion teams to transform institutional practices and policies. We wanted to support patient and community action groups. We call them fondly PCAGs, to strengthen research capacities and health actions within the community and patient organizations. And we wanted to learn how different institutional conditions might impact community engaged research. And that is the reason why we are working with 8 different sites. Over the 3 years, we will have cohort 1 and cohort 2 of these institutions. And so you all were the lucky winners. I love that phrase, Shral. I haven't heard it in so long. Lucky winners, chicken dinners. it's such a Midwestern phrase. I had a little nostalgia attack there. But in the first cohort, you were the winners as one of the first institutes implementing this intervention. We are also working with Texas, Colorado, and Pennsylvania in this first cohort. The second cohort is with Virginia, Commonwealth, Arkansas, Iowa, and our very own New Mexico school. So it's going to be an interesting 3 years for us to study this more deeply. But you might question, where did this all begin? And I'm really here, and I would say Virginia too, standing on the shoulders of giants. So many of you who do community-based research know of Dr. Wallerstein's work And this really centers around a long history of thinking about community-based participatory research. It begins, though, with the primary value that research should be with the communities, not on, not for, not in, but with the communities. So we are very centered around that principle of working with communities and patients to understand how better to do and how better to prioritize our research. It is also centered in the collective reflection and action praxis. So this really comes from Paulo Freire, who is Nina's longtime mentor and now our grandfather mentor, sort of by proxy, right? Who has written a lot about how it is important to have this reflexive praxis that we have action, we think about, reflect on that action, and we listen and we dialogue back and forth to be able to do better action the next time. And by doing so in a cyclical manner, we are able to create this action that believes, that has faith in people, and that can believe in the possibility that they themselves can create and change things, right? So it may be this idea of collective action is a very important one. By including more people, by having more dialogues, by listening broadly, we are leading to more better, meaningful action. It also honors the community's ways of knowing. So Etwap Muk is what some of the elders, Albert Marshall for Eskasoni First Nation say, is two-eyed seeing, right? It is the approach to co-learning and relationship building that integrates the Western and the narrative storytelling into research. It tries to see from both perspectives, multidisciplinary perspectives, community as well as patient perspectives, to be able to do better research. It is also guided by a community-based framework, community-based participatory research framework, right? Where we recognize what context we are working in, we recognize what partnerships we are working in, what actions should be taken, and how we can achieve those justice outcomes. So it's very grounded in that. It's also grounded in and follows the 9 principles that have been set out by community-based participatory researchers. And this is the long history that I'm reflecting on with Nina Wallerstein and Barbara Israel and Meredith Minkler. Their work has shown us how, if we were to truly say that we were doing community-based participatory research, we have to acknowledge communities as units of identity, build on existing community strengths and resources, facilitate partnerships that are equitable, collaborative, empowering, and address social inequalities, that are committed to co-learning and capacity building, ensuring mutual benefits, focusing on local issues of public concern, utilizing a cyclical, repeatable process, which you see the Paulo Freire and come back up here, and delivering, and we call this now dissemination science, results and knowledge to all partners, and then establishing that sustainable long-term partnerships with communities. So these 9 principles really do guide all of the work that we do in CBPR. But there's also a large history of E2Plus, and it really is this national think tank of equity scholars that have come together over multiple years that have led to some of this thinking, some of the grounding in science, and some of the more measurement-driven analysis in engagement science. There is a long history, like I said. It started with, a lot of support from the National Institutes of Health. And I'm going to go through these and then brings us to the current project. So I'll go through them in the next set of slides. But the first, grants really helped understand and expand upon that CBPR model, what aspects of the context were important, what are some of the partnership processes that are critical, and structures that are critical, and how those relationships can be built. So we had an idea, but we went deeper in this first set of grants to really expand on what we mean by the CBPR framework, research framework. There's an amazing paper by Lorenda Ballone that speaks a lot more depth into how they co-created this model, even with the community on the table. And I've linked all of this. I'm happy to share these slides broadly. I've linked all of these to to our website where more information can be found. The next phase came with creating more measurement tools using information from over 400 partnerships that we assessed and we were able to talk to and understand what those best practices were. Remember, there was not enough evidence on what are those best practices. How do you engage people? So this is the studies this is the set of studies that led to more of that measurement around how using key informants, using communities, using partners, how we can create partnership data, how we bring about a report on that. There is this concept of river of life as well, understanding. Some of you have done this in our first workshop, so it might be familiar, but understanding where each of our journeys comes from and how they collectively contribute towards our actions, our strategies right now. And then those were some of the tools that are also available on UNM's website, but essentially they borrow from the CBPR model and allow you to tackle each of these aspects separately. The next phase was a real change because remember, we were talking to partnerships, the communities and the academic partners over there. But what we weren't doing is understanding that they, as a unit, can only achieve so much if there is no institutional support. And that was becoming apparent as we talked to more and more partners, is that institutional support was critical to be able to move the community academic partnerships forward. So we envisioned, could some of our tools be feasibly used to support institutional change? And so along with our partners for the first round of the PCORI Engagement Award, we worked with the Morehouse Prevention Research Center, the Fred Hutchinson University of Washington Cancer Consortium, and Stanford Cancer Institute. And that's where, along with our partners, we were able to learn a lot. So what did we learn? First, we learned that how to better measure institutional context. So our first paper was actually just talking about the survey that we did and how to actually, because this is hard. How do you get academics and communities to speak about the same thing and understand what the differences are between the community that like perceives academic structures and community that and academics that understand the institutional structure quite a bit. I led a mixed method study of like looking at the three institutions and sort of comparing and contrasting what worked in one institution versus what worked in the other. So those institutional conditions that supported community engaged research. And then we also learned some basic, you know, basic lessons of like what could this intervention do to transform the academic centers to support patient and community engagement in broadly. And some of these lessons are really, oh, this was supposed to do a little animation, and I was not going to give you a busy slide. But anyway, let's work through this. The lessons were on the left side, broadly, you know, institutional context, internal, external, ongoing, and historical. This was right in the middle of the COVID pandemic. So we had to recognize all the broader external factors that were happening and were influencing our institutions at that time. Champion teams played a very critical role of facilitative leadership for institutional change. And the data that we collected from broader institutional partners really helped motivate the change in the academic centers. But we also recognized that there was not enough for leadership to be built within the community and patients that were impacted by research. And here's where the animation was supposed to come up and show that all three of the partners actually also wrote about their experiences within this project. So the first one is University of Washington, the second one is Stanford, and the third one is Morehouse. in-house, where we were able to have them reflect on this project as well and say what were some of the changes that were a result of some of the activities that we did in our Engage E2Plus project. So what is this E2 plus? What is this intervention, right? Like, what are we talking about over here? What are we hoping to do? This is a very, very complex intervention. The more I have studied it, the more I have thought about it, the more we have thought about it as a team, we are realizing we are learning so much. And sometimes it's like learning on the job, right? Like we are on the job and we are learning. And I just want to take a pause in a minute to acknowledge that the context is so dynamically changing right now as well for academic institutions, for community organizations, for just us as humans that are citizens of this country. And so we've just realized that there's so many elements to such a complex intervention. So what my job is what I thought I would do is to break it down a little bit and then show you the whole intervention. So bear with me as I walk you through this intervention. We begin with the champion teams, like I showed you, that I introduced you, who are these 10 to 12 individuals that are critical from both the academic and the community spaces, that have been there, done that, and have wise words of wisdom that we can learn from. They're connected to investigators, staff, and community partners within this institution. So that light red box is the institution, if you will. And there is an institutional leadership within that space, right? That's important to recognize. We also have created in this new project the set of patients and community action groups. And Virginia is going to tell you a little bit more towards the end of this presentation about them. And together, this is the group that is getting that we are working with from the University of New Mexico and our community consultants to facilitate some monthly meetings and reflections on data and potential strategies, and to build leadership within the patient and community action groups. We are also we are also conducting workshops and collecting data about contextual conditions from these larger set of investigators, staff, community partners, and qualitative interviews with institutional leaders. And in our interactions with PCAGs, generating some potential strategies for the champion teams to think about. So, what the champion teams are right in the middle of is really recognizing what are the data telling us, facilitating some discussions with us at UNM, and coming up with some potential strategies that could be impactful for the institution to support community engaged research. We also think that we are hoping towards the end of this project, we will build a community of practice with the other institutions that are also working in that same cohort and broadly beyond the cohorts too. So those could be other potential mechanisms by which we as an institutional group could learn more about what changes institutions. We think that we can reasonably expect a primary outcome of, if you look at the lower right of your screen, increasing some patient and community leadership in research. We also think that at the PCAG and the champion team levels, we can increase capacity of patients, community organizations to lead and co-lead research, and increase number of patients and community organizations interested in research. At the institution level, we really hope that patients and community members can influence more decision making. We can increase institutional trustworthiness and potentially hope for some changes in institutional practices and policy barriers. So here I'm going to pass it on to Virginia. Virginia, I'll drive your slides, so please just let me know next slide. Yeah.
Sure, absolutely. Thanks, Prajakta.
Yeah.
Yeah. Can everyone hear me okay? Okay, wonderful. I never know how my connection is going to be perfect. So thanks, Prajakta. Yeah, so the PCAGs, as we call them, we love our acronyms in E2 E2Plus, if you haven't noticed. We shorten everything and we hear our feedback, not to use so many acronyms. And we understand. So if I go off and do something, say stuff that you have no idea what I'm saying and I shorthand it, please let me know. I'm happy to explain, just as a upfront disclaimer. But our PCAG, I absolutely love working with our patient community action group. They are the heart and soul. It is a privilege and an honor to get to learn, especially for Kansas, since I also get to sit on the champion team meetings. So I get to see both sides, and it's really, really cool. Because I honestly went into this project not knowing anything about Kansas. And I've had such an amazing time learning about this wonderful community, but I'm still on the outside. So it's wonderful to have our 12 community members. Our members came from, there were some recommendations, and then there was an open call at our first workshop, which I see so many familiar names here. So it's so lovely to see you guys again. And there was a few people who decided that they wanted to continue the action and they got to join. So we have really, you guys actually, as for across all our sites, this is the largest PCAG. Most members are, or most of the group have about 8 members. So it's really great to see so many, have so much commitment and so much dedication to wanting to further this project. We're really excited. But yeah, you guys represent the PCAG. I say you guys because well, one, my language is weird, but two, there's a few members here. I won't call out names specifically, but it's so nice to see folks again. But there's a great representation, I believe, across the state. We've got some good, strong voices from religious organizations, from the community. We have community action or advisory board members who are stepping into this role as well. So it's a really great representation. The PCAG is led by Reverend Eric Williams and Reverend Tony Carter, and we're really glad to have their leadership. Both of them bring an amazing upbeat quality to our meetings, and strategizing and really thinking about how to move things forward. And of course, Michael Muhammad, myself, and Paige Castro Reeves, we get to work with you guys. It's our privilege again to support this and let the PCAG take the lead on where they're going. Next slide, please. All right, so what does the PCAG do? Well, we have, as for E2Plus, sort of a generalized idea, but we realize that we are not experts coming from New Mexico. I don't think even in New Mexico we would be experts to tell the community what to do. Well, I know we weren't. Absolutely, we're not. So the idea is we have sort of a general framing that we want to provide. We would love for the PCAG to become an organization that can start to build that research capacity, not only for each member, but through the organizations that they have, whether that's research that they are participating in as equal partners, doing co-publishing. We understand people are at different spectrum of where they are in the process of learning research. So we just are hoping that we can support them in building the capacity to whatever works for them, and just kind of keep pushing the needle. The next goal that we are thinking is to help the PCAG look at these, we like to call them our non-negotiable demands. These are things that the community is saying, okay, this research institution is doing all of this, but we think this absolutely needs to change. We do not want to settle for less. And it's an exciting opportunity to get to work across with the institution and find places, whether that's having more voice, whether that's having communities actually lead research themselves. We are open to all of it. We want the PCAG and the communities that they represent to really become the voice for what are the non-negotiables, what has to change. And along that line, we are also looking at how do the PCAG work with academics to promote education in the institutions of how to do more community research, how to learn from the community, how to make those changes. So that's where we're really excited to have folks like Alan and Aaron come in and be able to help facilitate those changes, help look at how can we get those voices heard at even higher levels in the institution as much as possible. So we'll go ahead and do next slide. All right, so what is our PCAG saying? Like, what are they doing? Well, we had our first meeting at the workshop, and then we've had one more. So it's still a new formation, right? This is still a new group. We're coming together. But as we're doing this, again, our national context is absolutely kind of bonkers right now. So how is the PCAG able to think and react, and what's happening? We've had a lot of really great conversation about that. So we're so excited to keep building on this conversation and look for these leverage points and these actions that are coming out from just communicating. And it's bringing people together is definitely one of the actions that we're hearing in the Kansas PCAG, but also in our other sites too. That there's a lot of fear that's out in communities right now. There's a lot of disinformation, misinformation, confusion, and the opportunity to bring people together and create safe spaces is limited. So when we get that chance, we are really excited to facilitate the dialogues, to have that moment of letting people connect and see. So I have a couple of quotes that our PCAG members have said. The top one on the right-hand side is, I'll let you guys take a moment to read. So this was said by one of our PCAG members who is one of our reverends. We have a bunch in our PCAG, which is lovely. But the idea of when institutions are being silenced, when the academic voices that have held so much power for so long are kind of being shackled, what and where can the community get the help, really start to not just continue the research. It's not about the research, but it is about data and connections and like finding ways to advocate for themselves within this ever shifted, like the shifting sands that we're standing on right now. And as a member of the clergy, they said, guess what? You know what they haven't silenced? The voices from the church. Maybe it's time that our voices come forward and we can help the academic institutions. We can start to take up the cause and we can become a place. So this is, I like that "you can't squelch me" part in that quote. I think that was really fun and very, very powerful. Like, we're not going anywhere. Community advocacy has been a central theme to many of the folks on our PCAG. For many years, there's lifelong advocates, and they're not scared and they're not backing down. So I think it was really nice to hear that they want to keep supporting the work that's being done. And the second quote, the one on the left, I'll give you all a moment to read that if you didn't read ahead. And so that quote really spoke to the data that research can generate, what is out there. And it's a way this wasn't a bigger conversation around misinformation, fear, how to cut down on the community feeling isolated and scared and under attack. And it's being able to take data that research has had in the past, but really being clear about how it's communicated, making it really accessible. So there's change in there. There's places that an institution can change. And it's, not using the large academic language, not using all of the acronyms that we love so much. It's finding ways to host data that our community can access, not just some sort of buried database that is really clunky and nobody knows. So they've got some really great ideas. These are only a couple, there's lots more, and we're going to continue to have conversations about that. So that there's definitely more to come. There's going to be more conversations, and more data from these discussions will be available at our second workshop. So absolutely very excited to keep seeing where the PCAG is going. The other beautiful thing is that our two PCAG leads, Reverend Williams and Reverend Carter, are also on the champion team. So there's a lot of dialogue of being able to bring back these conversations to the champion team. So we're trying to create these dialogue loops. We like our loops and spirals here, but the ability to keep conversations flowing. And then someday UNM won't be here. So it'd be nice to have these partnerships built so conversations can keep going even when, we're not asking when they want to have the next meeting. But that's the PCAG in a nutshell.
Thanks, Virginia. I'm going to come back in and just also talk a little bit about what we've been able to do with the champion team so far. We've had actually one workshop, and many champion team members really quickly recognized, how this was. They had to quickly adapt to understanding how to do a river of life in an online environment. So I just showed you some snapshots of the rivers of life where they were able to document their own journeys and how they came to be towards this collective space of the champion teams, as well as the community organizations that had joined us at the first workshop. And here's a few themes that stood out when we were talking in our group discussions, in our small group discussions, both with communities as well as academics. Many folks talked about how the economic investments and structural improvements that have been made in the community haven't always been made with community interests in mind. They wanted us to support transparency, authenticity, and inclusivity in our partnerships. This one was a very apt one for right now. Researchers have to work hard to help communities understand the value and the benefits of research in general. It's not always apparent to everyone right away, So that was a really important lesson that we were learning from all of these conversations. And I want to end with something that in our last champion meeting, we really all came together in saying that this might be right now the opportunity to create spaces and to create discussions around how researchers could start collaborating with the community even before those research priorities are set. So what are we doing in terms of our strategies, our priorities that create the ability for communities and academics to come together? And I do think that the MARG group is one fantastic opportunity that this is already happening, where dialogues and discussions are happening broadly. So hopefully this is something that we can piggyback on and bring more data back to you guys as the project comes as we move forward in the project. So with that, I wanted to just show you where we were in the project. You see, this was our set of activities that we had planned. We've developed a champion team. We've collected a broad survey, data baseline survey from all of you. We've developed a PCAG. We've had some meetings with them. We've done the first workshop. And now we are at this phase of collecting more qualitative data with community members, investigators, leadership. And that will lead us to bring all of this data to the second workshop. So we hope you'll all join us for the second workshop. I remember the first workshop was advertised broadly to the MARG group as well. So please do plan on joining our workshop too. And then we will start the work. Now that we understand the data, we understand the context, we understand what some of these suggested priorities are, we will spend the next year actually working on those priorities and making them a reality to change and support institutional practices towards engaged research. So with that, so many folks to thank and so many folks on which we are able to build this work and this project specifically. So we're very happy to end a little bit early and have some time for dialogue, which is what we strive for.
Thank you so much for this overview. My question, since I found out about the project, was, have you noticed differences in the different regions of the country, or have you found that the data that you're receiving is the same?
It's a great question, and I have been reflecting quite a lot. That is the reason why I put that little circle on community of practice with other institutions. Having being an implementation scientist and like understanding how organizational change happens, you cannot ever underestimate the peer influence on change, right? Like, and so if most organizations, I've always been tuned into that, Sharila. So thanks for asking that question. What I'll say in a quick, without going into details, is there are similarities and there are differences. So there are differences in terms of like how some of the local political context is influencing how federal context is being perceived and how institutions feel susceptible in this current context, I will say. But there are similarities in the fact that all of us are facing those attacks together. We are all now being lumped as academic institutions. Community partners are being lumped together, and communities are being stressed in different ways. Whether it is our LGBTQ communities, whether it is our racial ethnic minoritized communities, they have different stressors. But I think what has been hopeful in the past few meetings, because I will be very honest with all of you, that I was in a really like lump period my own self. But what has been really hopeful is listening to the patient and community action groups from across these four institutions. And where there is energy and momentum is one, a recognition that this is just yet another context that we have to adapt to. We've always done this. We've always had to face challenges. We've always had to, and as Virginia was saying, even our PCAG is saying the same thing, is like, well, buckle up, here we go again. And the other thing is that this is, at least the hope is that in the last 6 years, 5 years of this enthusiasm and motivation, we've opened up spaces for communities to talk to us a little bit more broadly than I would say 10 years ago, right? And so how do we leverage those? How do we move those spaces forward to create more centering of the community and patient voices? Is where most people are, because I think it was Alan who said in our last meeting as well, is that maybe our academic voices are silenced, but the community voices will never be silenced. So maybe this is the time for us to support and facilitate the community voices to come in. And that's something that we have seen hopeful across the board. So we're really, really not losing faith.
Thank you.
Other questions? It can't be that simple. This is a complex intervention.
Well, I have a question about the kind of institutional leadership portion of your work, and how well are the messages that are coming out of your the CPAC, the Community
PCAG,
Action Group, PCAG groups, how well are those being received and responded to by institutional leadership?
Yeah. Frank, great question. We haven't gotten to that stage yet in this current project. So what I mean by that is our data are still being analyzed, And we are still working to collect some interviews and informational data, like qualitative data from the institutional leadership right now. So what that results in is we are going to do an analysis at our team, present that analysis back to the workshop too, which is where the second workshop would happen. And that really defines our interpretation, Frank. Like, well, what does this mean, right? Like, this is just data, but not data needs to be synthesized and thought through and interpreted and co-interpreted with community to be able to derive some strategic opportunities, some actions that we can take. That's what we hope is captured in what we do is we create like a partnership data report, essentially, or like a memoria is what we've been calling it recently, is this idea of like, what did we do when we came together? What are our outcomes from us coming together? And I have an example if you're interested in seeing it from our first workshop. But that's then what we would hope that the champion team would take as their data points. The workshop 2 will have a little bit more actual data, but we are hoping that this is what arms the champion teams to be saying that, look, this is the data, here's what we need to do, how can we do it? And that's what second year will look like, Frank, is that the strategic working groups that will take these priorities and start work on those priorities. I have no idea how the leadership will receive it then. So that's to be told.
I can't say, Frank, we tried to get all of our senior leadership at KU and KU Med to respond to the survey that we sent out a few months ago. I don't know what we got in terms of response, because and I wasn't expecting all, like, the chancellor necessarily to fill out the survey. But we did get, I will say, we got a response from the head of our cancer center almost immediately. And I do think there are some pockets of leadership, like, and Prajakta, you've done a lot of work at NCI in the past in your fellowship. Like, the cancer folks get this in some ways, maybe maybe they're ahead of the curve in terms of their leadership. And I hope we can, one of my goals would be, how can we spread that broader across the landscape of all health issues, to make a difference and get those leaders really bought into promoting this work and fostering it.
I was wondering if you could talk a little bit about the first workshop that you gave, and then the one that's coming up. You did mention it, but when you call it a workshop, I'm interested to know what makes it a workshop. How can we support your work in this next phase in that space?
I would love to show you perhaps the memoria that we created from that first workshop. And we can distribute this as well, Tamara, after this call. This is for wide distribution. It tells you a little bit about how we introduced the project, how we envisioned our project based on the CVPR model. And then we did some small discussions to talk about these two big questions. How is the changing national context impacting the work we do in our communities, and what are the ways that universities can continue to support communities? Then those small group discussions led to this River of Life activity, where we reflected on our own journeys as community members, as academic members. And that's how we created these Rivers of Life. That online, we basically put post-it notes and pictures and just created like our rivers that came together as CTSA. That gave us a lot of direction. And this is, you can tell very quickly, this is the academics doing it in a OCD fashion, right? And so these were all of our journeys that came together. And then we said, based on all of these discussions, we recorded notes as note takers, all of us, in all of these discussions. Then we analyzed all of these discussions to say, what are current challenges and what are some opportunities that we can do? The next workshop will be a little bit different, where we have a goal of presenting the data back and asking for more feedback in that data. So again, it's small discussions, reflections, interpretations, and then visioning the CBPR framework and how we can be strategic in what we prioritize. So having you all join would be fantastic in just, coming prepared to do some work.
Thank you. And learning a lot too. So much
Of all of
appreciated.
us, about all of us, right? Like it's that collective learning is where I think, do our best. I know I've taken up all of your time, so please do. I'll put my email in the chat. So if there are any other questions that come up, or you just want to have a chat about the project, I'm happy to touch base, or come join us at the workshop.
Thank you so much again for getting up, mountain time. And I think this is really helpful for myself and for those that have already messaged me to say they couldn't make it and they will watch the recording to help understand the project better and why it's important for them to be involved. So sometimes, like reading the flyers, it feels overwhelming, but actually hearing and seeing real people attached to the project, I think will be a big part of the push to workshop number 2 and that attendance as well. So I will send an email to you both requesting your presentation information. As you can see, people already want to see it and digest it in another way. And so I'm so grateful. Thank you so much again for coming. Thank you to all of our MARG members. Please continue to send me your flyers, your community events, so that I can send them out to all of our MARG participants. And have a great weekend. Thank you so much, everyone. Take care.
Thanks.
Thanks
Bye.
again.
Thank you.
Thank you all
Thank
for
you.
having us.
Thank you.